COPD is one of the most common chronic respiratory diseases nurses will see in both clinicals and on the NCLEX. What is COPD? COPD stands for chronic obstructive pulmonary disease. It is a progressive lung disease that causes airflow limitation, making it difficult for patients to move air in and out of the lungs. The key word here is progressive. COPD worsens over time and cannot be completely reversed. COPD mainly includes two major conditions: chronic bronchitis and emphysema. Let's break those down. Chronic bronchitis involves long-term inflammation of the bronchi along with excessive mucus production. These patients produce large amounts of sputum and usually have a chronic productive cough. For NCLEX, remember this definition: a productive cough lasting at least 3 months for 2 consecutive years. Because oxygen levels are often low, these patients may appear cyanotic and are sometimes referred to as blue bloaters. Emphysema involves destruction of the alveoli, which are the tiny air sacs responsible for gas exchange. The alveolar walls break down and lose elasticity, causing air trapping inside the lungs. These patients often work extremely hard to breathe and may appear thin because breathing requires so much energy. They are sometimes called pink puffers because they puff while breathing and may maintain pink skin color until late disease stages. Why does airflow limitation occur? In COPD, airways become inflamed, excess mucus blocks airflow, alveoli lose elasticity, and airways collapse during exhalation. This creates air trapping. The patient can inhale, but exhaling becomes difficult. Over time, the lungs become hyperinflated because trapped air stays inside. That's why many COPD patients develop a barrel chest appearance. Causes and risk factors. The number one cause of COPD is smoking. This is one of the highest yield NCLEX points. Other risk factors include secondhand smoke, long-term exposure to pollution, occupational exposure to dust, and alpha-1 antitrypsin deficiency. A major nursing priority is smoking cessation because stopping smoking can slow disease progression. Pathophysiology: COPD causes chronic inflammation, narrowed airways, and increased CO2 retention. Many COPD patients become chronic CO2 retainers. Signs and symptoms. Patients commonly experience dyspnea, chronic cough, sputum production, wheezing, fatigue, and reduced activity tolerance. As it worsens, you see barrel chest, accessory muscle use, pursed lip breathing, and tripod positioning. Emergency warning signs include restlessness, confusion, and decreased level of consciousness. Diagnostics. The most important test is pulmonary function testing, PFTs, showing reduced airflow and a reduced FEV1-FVC ratio. Oxygen therapy. This is a critical safety point. Giving excessive oxygen can worsen CO2 retention. Target saturation is often